Pro-life advocates may be breathing a sigh of relief in Idaho after the Justice Department said it would likely drop a Biden-era federal lawsuit. Idaho has some of the strongest pro-life laws in the country, with protections for the unborn throughout all 9 months of pregnancy. The Biden administration sued Idaho, arguing the state's federal law required doctors to perform abortions in emergency situations if a patient's health or life were at serious risk. Idaho pushed back, saying that their state law allows for abortions in life-threatening situations and that the Democratic administration was trying to improperly expand its exception. Dr. Ingrid Skop is a practicing obstetrician gynecologist and the vice president and director of medical affairs at the Charlotte Lozier Institute. Dr. Skop, you are on the front lines of seeing pro-life laws in action. Can you clear up any confusion for us? Is there any pro-life law that actually prohibits a doctor from performing an emergency abortion if the mother's life is at risk?
Yeah, thanks. This is great news, this action, because we see that the prior administration was trying to utilize EMTALA in a coercive effort to promote abortion. No state, including Idaho, does not allow a doctor to use his clinical judgment to determine what intervention is needed in a medical emergency and to provide that. So doctors can already intervene to protect a mother's life in Idaho. EMTALA, by the way, requires evaluation, stabilization, and transfer if needed, but it considers both the mother and her unborn child to be the patient in need of care.
There were some doctors in Idaho that alleged that they had to airlift women out of the state to get an emergency abortion. Do you see a circumstance where a doctor would not work on a patient right in front of them?
No, and in fact, this is a very dangerous action to say, because again, Idaho law allows the doctor to intervene immediately. And if that is an abortion that is needed to protect that mother's life, the law already allows it. But we can all understand that airlifting a patient out of state is going to take time. If she's in a true medical emergency, then she needs that intervention at that moment. And again, that's what the state law allows. And EMTALA confirms that that patient must be given the emergency care that she needs.
Thank you for this much needed clarity, Dr. Scott.
Thanks. Great to be with you.